The battle over your medical care rages on. America's healthcare debate represents an age-old struggle between the sovereignty of the individual versus the power of the state. Is the president's new healthcare plan true healthcare reform, or merely a transfer of power to Washington? Is your doctor now accountable to you or the government? Who determines the quality of life? Who determines the quantity of care? Your very life depends on who wins this battle, because whoever pays holds the power to choose. When pushing for healthcare reform, the president assured the American people his signature legislation would not add to the deficit.
It will slow the growth in healthcare costs without adding a dime to our deficits.
He promised seniors they could keep their doctor.
No matter what you've heard, if you like your doctor or healthcare plan, you can keep it.
He promised America he would cut the deficit in half.
I'm pledging to cut the deficit we inherited by half by the end of my first term in office.
However, none of these promises proved true. The actual cost of the government takeover of healthcare stands at $2.5 trillion. Many employers say they will be forced to drop their healthcare benefits. Many seniors now struggle to find a physician. When President Obama took office, the national debt stood at just over $10 trillion. It now exceeds $16 trillion. Washington has run out of money, and the battle over healthcare rages on. But now, physicians stand in the gap to protect access to care for America's seniors.
I'm Dr. C.L. Gray. I became a physician because I wanted to care for individual patients. In fact, I still practice hospital-based medicine in Western North Carolina. But I have started to see a fundamental transformation of the patient-physician relationship as Washington imposes itself on medical decision-making. Seniors feel this heavy hand of government and the growing instability of Medicare. For example, in 2010, for the first time in Medicare's history, Washington withheld payment to physicians on 4 separate occasions. Medicare funds had run dry.
The biggest driver of the federal debt is Medicare costs. Nothing else comes close.
The Congressional Budget Office recently stated that, beginning in 2013, the president's health care legislation would cut Medicare spending by $716 billion over the next decade.
The fact is that the Affordable Care Act has done more to rein in rising costs and attack the federal deficit than we've seen in years.
As of October 1st, 2012, Medicare will not pay for the second hospital bill if a senior is readmitted to the hospital for the same problem within 30 days. What are some of President Obama's other ideas on how to control the cost of Medicare? Let's look at 2 sections of the bill. Section 3007 establishes the value-based payment modifier. This gives the Secretary of Health and Human Services the power to reduce a physician's Medicare reimbursement if that physician does not follow her mandates. This is an extraordinary transfer of power to Washington. In just these 2 pages of the law, power is delegated to the Secretary of Health and Human Services on 21 separate occasions. The Secretary shall establish by the Secretary, determined appropriate by the Secretary, determined appropriate by the Secretary, the Secretary, established by the Secretary, determined appropriate is established by the Secretary. Now let's look at Section 3403, the Independent Payment Advisory Board, otherwise known as the IPAB. What is the purpose of the IPAB? Quote, purpose. It is the purpose of this section to reduce the per capita rate of growth in Medicare spending. The Affordable Care Act established a board of 15 unelected, unaccountable individuals specifically tasked to reduce Medicare spending. Those who champion the IPAB believe Congress will never control the cost of Medicare. Their idea was to give legislative authority over Medicare spending to a small panel of bureaucrats who do not answer to the American people. As I researched this healthcare legislation, I found it was based on a philosophy where the state held contempt for those they considered to be a burden on society. This worldview is most clearly seen in a paper published in January of 2009 by the Director of Bioethics for the National Institute of Health. He proposed a method for determining who should receive medical procedures in an age of scarce resources. His complete live system produces a priority curve that allocates medical procedures based on age. Those between the ages of 15 and 55 stand the most substantial chance of receiving care. Those over the age 55 will have less access to treatment, but this is when seniors need care the most. He explains, quote, "Unlike allocation by sex or race, allocation by age is not discrimination. Treating 65-year-olds differently because of stereotypes would be ageist, but treating them differently because they have already had more life years is not." Who was the National Institute of Health Director of Bioethics? It was Ezekiel Emanuel, the brother of Rahm Emanuel, the former White House Chief of Staff. As it turns out, Ezekiel Emanuel was also a White House healthcare policy advisor during the development of the Patient Protection and Affordable Care Act. In this graph, we see a worldview that considers our seniors a burden on society. In the Patient Protection and Affordable Care Act, we find the transfer of power to government to implement this worldview. The public was led to believe that physicians supported this legislation. That is simply not the case. Most physicians do not want to practice medicine under the heavy hand of government. A recent survey showed that 40% of doctors may leave medicine within the next 5 years. Government compassion sounds so noble, but in the end, whoever pays holds the power to choose. In 2006, I founded Physicians for Reform to preserve the patient-physician relationship. The good news is there is another way forward. Please visit us at physiciansforreform.org and join me in this effort to keep patients and physicians at the center of American healthcare.